Molina. He's the Chief Science Officer at eMed. That's a biotech software company that offers at-home testing. And he's also a former professor of epidemiology at Harvard University. Doctor, thanks so much for being here. And I just want to start with the at-home testing because there are so many questions about whether they're effective right now, particularly with Omicron. And I know you have some skin in the game because you're at an at-home testing company. But I just want to play for you what Dr. Rochelle Walensky said of the CDC. And it sounded like she was saying that they basically are not that reliable right now. So listen to this.
We opted not to have the rapid test for isolation because we actually don't know how our rapid tests perform and how well they predict whether you're transmissible during the end of disease.
So can we rely on them to find out if we're positive or not?
Absolutely. That, unfortunately, I don't think is founded in all of the science. The science says quite the opposite. It's that when your antigen test is positive, you are very likely to have what's called culturable virus, meaning live infectious virus in your specimen. I don't think that that was a correct statement about what these rapid tests do and do not do.
Well, what do you think that Dr. Walensky got wrong? I mean, what do you think she doesn't understand?
Well, if you are positive on one of these tests at day 5, when there's now a suggestion to leave isolation, you should assume that you are still infectious. All of the data shows that if you're positive on a rapid antigen test, you still have infectious virus in you. And you can actually look at the darkness of the line that forms. If it's a bright dark line, a bright red line, for example, it means you have 100 million or a billion viral particles per mil still in your nose to cause that. So it's still very infectious levels.
That's very interesting to know that the darkness of the line tells you something. I didn't know that. But can't you also be testing positive for weeks after you are showing symptoms? I mean, haven't we heard anecdotal cases of people who tested positive for a long time, even after maybe they weren't even shedding the virus anymore?
Yeah, so these are two very different types of tests, and this is exactly what I've been talking about, frankly, for 2 years. The PCR test, the laboratory PCR test and molecular test, they can stay positive for weeks or months, which is why we should never have relied on a PCR test to tell us whether we need to isolate, because most people taking a PCR test, especially those without symptoms, get tested after they've already been infectious. And that's why a rapid test, these antigen tests, are very specific. They'll only turn positive when you are infectious, which is why they are the better public health tool, even if PCR is the better tool for a doctor who maybe is interested in asking the question, have you been infected in the last couple weeks or even possibly months?
Okay, that's very interesting to me. But do the at-home rapid tests that you're talking about, do they detect you at the beginning of your infection? Or are there some days where you're infectious or you're just developing the infection and it doesn't turn up positive?
Yeah, that's a great question. So what we're finding with Omicron is it's a more infectious virus. And so we're actually finding that sometimes when people are getting their symptoms for the first day, for example, they'll still be negative on a rapid test, and then they'll turn positive that night or the next day. So my suggestion is if you feel symptoms of coronavirus, assume that you are positive, quarantine and take steps not to infect others. But if you have a test, use it the next day or maybe even 2 days later if you can, to be sure that you actually catch yourself and see that positive rather than testing too early.
What about for parents of kids who are under 5 years old who can't get vaccinated? Do these tests work on little kids? Because the instructions seem to be giving different guidance.
Yeah, so the instructions, and this is an important point, when you read the instructions that are provided through the FDA program, that is just based on how the studies for those tests were done. But absolutely, the tests still work for young children. They work regardless of symptoms. They work identically. The test cares about the amount of virus you have. It doesn't care about who you are, what age you are, or what kind of symptoms you have. It is looking for virus, and that's really all these tests are able to do, is look for virus.
So it sounds like you think that the CDC, the new guidance of a 5-day isolation period instead of a 10-day is what? Just a misfire? I mean, are you aligned with that philosophically, or you don't like it?
No, I actually feel very strongly that this entire pandemic, we should have been doing everything we could to shorten the isolation period by using information from a rapid test to ask the question, before I leave isolation, am I infectious? And maybe that happens for some people on 2 days, maybe that happens for some people at 12 days. So we can shorten the isolation period from 10 days, but we should do it with evidence that we are no longer infectious. And the reason is that the people who have been diagnosed and know that they are infectious and are 5 days out from that diagnosis are still probably the highest risk people for onward transmission in our society. So we should probably at least be making sure that before they go to work that they are negative, rather than having them go to work and potentially causing 3 new people to become infected and having an additional 3 people each having to take 5 or 10 days off of work.
Okay, Dr. Michael Mina, thank you. Really interesting to hear the details of how to do this. Thank you.